Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and all I perform is cosmetic or aesthetic plastic surgery. One of my favorite procedures that I perform is facial rejuvenation or facelifts, and I pride myself by how many I perform and by how happy my patients are. I think it's really important to understand that the most important decision about having a facelift is who performs the facelift. So a common question is that when patients come in is, how do I avoid having a stretched or pulled look from the facelift, and how do I perform that as a surgeon? The first thing to understand, like I said, is the most important decision is who is performing the facelift. When I perform a facelift, I perform a smash facelift, which actually does not pull the skin at all. All of my tension is based on the deeper tissues, and that tissue plane, the plane below the fat and skin, is used as a fulcrum, if you will, to pull the other layers up with it. So when I perform my facelift, I'm actually shifting the facial fat back up in a vertical direction to where it belongs, generally around the cheekbones. I'm taking the jowl fat and putting it back along the cheekbones. I'm defining the jawline without pulling the skin. So how do I accomplish that? By permanent fixation. So when I use that tissue plane, I will fixate it to the deeper layers along the cheekbone and behind the ear so that there is absolutely no tension on the skin. That provides a contemporary, beautiful, long-lasting result that looks better and better over time as opposed to worse. Oftentimes I will be asked to look at somebody's facelift and tell them why they look the way that they do, why they look as though either nothing has been done or they look at worse at a year after having their facelift, and almost always the reason is technique. I think that the patient generally presents with skin that has been pulled. I think that none of the deeper work has been performed or performed properly, and consequently people show telltale signs of having that sort of facelift, and that's why patients look worse over time. Patients get a pulled look, they get shifts of the hairline. When they put their head down, they can see some vertical lines. None of that happens with the deep smash facelift that I perform. So the best way to understand that, again, is to understand that no tension is placed on the skin. Tension is the killer here. Tension provides those tension lines that are visible in a facelift, especially in people that have sun damage or a lot of tanning. You can see the lines of pull, and that looks awkward. Tension also causes distortion of the ears that look pulled. It causes scars that are visible and causes less than an optimal result. So the best way to understand that is to come in for a consultation, understand that when a facelift is performed beautifully and naturally, I don't think anybody should be able to tell. I think although the before and afters may look dramatic, the nicest compliment that I get, and I get it all the time from my patients, is that nobody can tell this has been performed. The reason being is that no tension is placed on the skin, consequently no distortion is created, and everything is put together like a nice outfit. Most commonly, I'll perform a brow lift along with the eyes and a facelift, along with fat transfer, plus or minus some laser. There are options now for people that are not ready for the full facelift, and that is something that I developed called a Gen X lift that provides a short scar facelift with the same principles without pulling the skin, giving you a much nicer, natural result in patients that may not be ready for the real deal. Okay, so the best way to get an idea is come in for consultation. Thank you.